As an overarching sort of system, let's say, I think we were trying to get the system working together across a larger footprint. So as well as sort of individual teams working together, we wanted to have, let's say, interventions that would span 2 different hospitals, or let's say cross out the boundaries and with people bringing them together all around the table, working together for a common aim.
The power of teamwork and the power of ideas, and everybody coming in with something different and coming in with it from a different angle.
I've had the opportunity to meet with frontline teams and I've heard loads of good ideas coming back from clinicians, but we've never been in a position where we can implement them. So for me, the challenge was creating a space where I can get frontline teams together to work on something that is going to make a difference to patients going forward.
I think in terms of the 3 schemes that we've piloted, we've got furthest with the general surgery scheme, so where we're looking at our gallbladder patients and bringing them into a semi-elective list, and we've found that we've reduced our time for patients from referral to treatment or presentation to treatment by 50%, which obviously is fantastic in terms of a reduction in time for a patient waiting for an operation. Hopefully that will tick boxes for patients. They'll be in pain for less time, they'll get their operations sorted quicker. So I think from my perspective that's been the greatest impact.
Yeah, and I think general surgery's been a real star of the show, but I think in terms of potential impact, let's say for gynecology, let's say as well, I think they've come a real long way from people being quite disparate and actually forging relationships and working together to come to an actual model of care where you've introduced sort of nurse-led clinics, for example, in primary care. So I think that's a massive impact for patients as well. But I think it's, as well as the tangible stuff, it's the non-tangible. So behind the scenes, we want people working together to come across different areas to say, well, actually, how can we improve the patients across areas so people don't get, and again, what you were saying about clinical variation as well before, so people don't get a different care kind of in one area compared to another. So for patients, I think that's going to be a massive impact, that they don't have to travel as much, and with standardising kind of the care that they receive and the quality of care that they receive all across our STP.
Yeah. What's had the most impact is the fact that it's primary care and secondary care talking to each other a lot more, and we're getting that cross-fertilisation of ideas both from a secondary care perspective into primary care. I think the other thing that's helped patients the most is the fact that we've been able to put education sessions on together, so it is not primary care referring on for a second opinion, but it's our clinicians coming together to give that single point of input into our patients, and I think that's what's made the biggest difference, and I think some of the feedback that we're getting back from patients already suggests that was the right thing to do. With some of our respiratory work, where we've been out in the community, in GP practices, with patients, with our secondary care clinicians, and what I've really loved about it is that it was only ever something we talked about, whereas this time we've been able to get the right people from a variety of organisations together in a room to be able to do the things that we want to do.
So whatever their role is, whether they're a physio assistant, an OT or a respiratory nurse, or indeed we had a patient and a patient's carer on our group. So that, you know, having those different aspects from everybody was really, really powerful.